Hi, welcome to the StellaLife Innovator Series. I'm Liz Lundry, and today I have the pleasure of interviewing the amazing Angie Stone. Angie is a hygienist. She's absolutely an innovator. She is an international speaker, speaking at such events as RDH Under One Roof this July 2021. And she also has written a best-selling book, Dying from Dirty Teeth. So Angie is always out there helping me. You have been a source of inspiration and information for all of us for years. And we're so grateful to have you as part of our community. So you solve so many problems for so many people. And what I'm finding as I talk to my doctors all across the US, now more than ever, I'm getting doctors asking me, hey, Liz, I'm looking for a hygienist. Do you know of a hygienist who's looking for a job? I get this a lot. And again, I haven't had this question asked of me as much as I am right now. And I know how difficult that can be. So Angie, let us know, what is it that you're doing that can help all of us on this?
Oh my gosh, Liz, thank you so much for having me today, and thank you for your kind words. I'm simply blessed and honored to be asked to do things and help people learn. And I'm excited about a new avenue that I've learned about. I'm actually now the director of hygiene recruitment at a company called Bridge Resource Group, or BRG for short. It's a lot easier. And so in my role with BRG, I am placing hygienists in amazing offices. That's my goal, right? And the goal is to get those amazing offices, amazing hygienists. So many times we'll know that, we'll have someone either working in our office or we'll be working in an office. So I kind of have, the dentist side and the hygienist side here. And maybe it's not the best fit, right? And so I think that what excites me the most about being an executive search person is that I can help the dental practices find, as we like to talk about, the person to be in the bus in the right seat, right? Because that becomes so important. If the goal of our practice is to have the best possible treatment and care for our patients, which I think that's hopefully our goal, right?
Absolutely. So, what does BRG do, that makes it different and compared to the way that we've been doing this for decades, where we place ads or we do it online, how is this different and how is it more helpful?
Well, that's a great question, Liz. And as you and I talked about earlier, it's like, I'm so old that I used to look through the newspaper to find a job, right? Who does
Me
that
too.
anymore? Right? And so the world really has gotten away from the print ads on some levels, and we're doing a lot of posting. We're looking at the Indeeds and the glass doors and the Zip Recruiters, which is fine. I mean, we can find, if you're a dental practice looking for a hygienist, you can certainly find hygienists using those platforms, right? As you mentioned to me, Liz, it seems like people are having a tougher time. I think that the pandemic has influenced the hygiene world, and it's becoming more difficult to find a hygienist. And so what happens is you can post, and hopefully you'll have good results and you'll find that magic person. That's great. Sometimes dental practices get to the point where they're like, oh my gosh, we need a warm body, right? And so now what they're doing to do that, and this is great too, because this can work in a short term, is they are maybe looking to those temp agencies, right? So they list the days that they need somebody. Maybe they're filling in for a vacation or maternity leave. That can work as well, right? Executive recruiting is different though. What we're doing is we want to work with the practices that are looking for that right hygienist, right? And so we all know that even though we all, and any profession is like this, you have some people who are in the profession and they do their job and they're fine. then you have in any profession those stellar people, right? And that's what I focus on is I want to um, help those practices that are stellar practices find that stellar hygienist to come alongside of them and be their partner to help take the absolute best care of their patients that we can. Does that make sense?
Absolutely, because I imagine if you're out there, you're in your office, you're the office manager or the doctor, you're trying to find somebody, and there are people that are fresh out of school and they're wonderful, they're on their journey, and
Mhm.
people of varied talents and experience. But in this, we using this way, you can actually find people that aren't out there advertising they're looking for a job. They may be just looking for the perfect fit for them, the right opportunity, and nobody even knows that they're out there.
Yes. And so what you just explained so eloquently is that there's a difference between and again, this isn't just hygienists or dentists. This is how this works, right? There's people that are in the market and there's people that are on the market, right? So the people that are on the market are the ones that are perusing those postings that everybody's doing, right? Um, and sometimes the people that are on the market aren't really maybe they're not the best fit. Maybe they are. But executive recruiters have the ability to reach out and connect with the people that are in the market. Those people who you just mentioned that are working with their heads down and maybe not exactly in the perfect spot, right? But they're like, I'm just going to stay here, because I'm just going to stay here. I don't know what else to do, right? And if I can find an office that's like, hey, Angie, this is the kind of hygienist we're looking for. Maybe they're okay working with a new grad, right? So I can help them to find that new grad. Maybe they have it. I can help them to find exactly what they're looking for, right? Because then I can go out to the candidate and make sure that the candidate is wanting what that office is needing. And so what we're trying to do is place people long term, the right seat in the bus.
That's such a great point because I've been a consultant and an in-office trainer for 30 years, as well as being a hygienist myself for 40. And I've been in that position where I'll just stay here because whatever reason. But many times when I've gone into practices to do training, some of the hygienists that are right out of school, if they really have that right attitude, they can be wonderful because they can be kind of they'll learn what the culture is of this practice starting fresh. So sometimes they can be absolutely the perfect candidate. And other times, an office will need somebody who's just seasoned and ready to go. So it's so great that you can kind of match up what is going to work best for that practice.
And what a great opportunity to have a seasoned rock star hygienist mentor a new hygienist and maybe a hygienist that was at the top of their class, right?
Yes.
And it's like, this person is just so excited to learn. And you have a rock star hygienist that is just dying to teach someone and have someone to mentor. I mean, how fabulous is that?
Yeah, it's a great opportunity. And you also help to place associate dentists, right? So not
Yes.
just hygienists.
Yes. And so BRG is exclusive only in dentistry. So that's another thing that sets BRG apart is that they're not dabbling in any other fields. It is exclusively dentistry. So my desk partner and the founder and owner of BRG, Dave Cunningham, he and another desk partner, they do executive search for dentists. And so that can be for dentists that are looking to bring a dentist in, or it can be for a dentist that's looking for a place to be, as well as the hygienist can come to me if they're looking for a place to be, and then I can figure out what they're looking for and then go on the hunt for a practice that would meet their needs.
Yeah. And, as I was checking out the website myself to learn more, and something that we had actually talked about before is when we're trying to find somebody, we generally look in our own area, but there may be hygienists and dentists who live on the other side of the country who maybe want to relocate, or if they have a better opportunity, will relocate. And this is another advantage that you offer the doctors who and hygienists who are looking for these positions, because otherwise we wouldn't have access to those people other than the Indeeds and all. But you actually help to relocate people too.
Yes, so there is a relocation process that is gone through too. So if there is, a relocation, we will help, with that. We work with the dental practice to understand, hey, we have this great fit, and they need to relocate. What does that look like? And so we definitely at BRG are the hands-on, walking with both the dental practice and the candidate, whether that's a hygienist or a dentist, and walking them through the entire process. And so it's really quite different. Executive recruitment is really quite different than what we're typically accustomed to.
That is great. So can you tell me what is the process? So if there's somebody on this call who would like to learn more or wants to get started, someone who's looking for a position or looking for a hygienist, what would they do?
So the first thing would just be to email myself, and then I can direct them to the appropriate channel. And what we typically do, if it's a practice that's looking for someone, we would hop on a call. We would take into account on that call, we would start to do some research as to what is it they're wanting. What is the culture of their office? What have they done to try and fill this position? What hasn't worked? And then also fill out, have them fill out some candidate profile. We also tell them what BRG does. And so they get a better understanding of what I can do in just a couple of minutes. And that's simply just about a 20-minute call. And then the person that reaches out to us, they can be like, yeah, this is great, or no, this isn't for me. And likewise, BRG can be like, hey, this is great, or no, this isn't a search that, that we are willing to take. So it's not like we just, take every single thing, because it has to be the right fit for both parties. And so they can simply email me to get more information. They can also visit the BRG website, so bridgeresourcegroup.com. So that's what I would recommend.
That sounds awesome. Well, I'm excited again, because now I'm going to be sharing this with my doctors, and we're just always grateful to you for everything that you've ever done. And thank you for your ongoing support of all of us clinicians, which means that you're able to help, millions of patients by getting the right teams in place and really taking the standard of care up. So we appreciate you tremendously. I want to really thank you for joining us today and sharing this information. And for all of you who've joined us on the StellaLife Innovators episode today, thank you for your time. And please come back. We're going to have more interviews and more innovators. And in the meantime, stay healthy, stay safe, and stay happy. Thank you so much. Bye, Angie.
Thanks,
Bye,
Liz.
everybody. Thanks, everyone.